about how you would go about taking the history from somebody,
Right.
and how would you do that? How does that work?
First of all, when methadone first came out, everyone thought that's going to be the answer
We sure did.
to the opiate
Yes.
addiction. Came
Yes.
out, I don't know, in the 50s or 40s. I don't know when it came out, actually. Unfortunately, though, people learned that they could abuse the methadone. And so when they, Suboxone is made up of two medications, buprenorphine and naloxone, okay?
And other people know that as Narcan.
Yes.
Which is what people have in their shelf nowadays
Right.
at their home that they can use if somebody overdoses.
Yes.
Okay, go ahead.
Good,
Yes,
thank you.
yes.
So buprenorphine attaches itself to the opiate receptors in the brain so that it satisfies those opiate receptors so that they don't want more. And so the two things that does is it stops withdrawals, which that's one of the things
That's
that separates
amazing.
opiate addiction from all others, because the physical withdrawal from opiates is none like anything else. And people can't tolerate that. They want to quit, but they just can't get past that, the withdrawals. So that's the buprenorphine stops that, and it stops the cravings. The naloxone is in there so that buprenorphine didn't become just another methadone,
Right.
because it caps off, so that if a person took 7 or 8 Suboxone at the same time, they get no more benefit than if they took just one.
So you really can't even overdose on those
can't.
medications because it
Right.
has the overdose medication in
That's
it.
right. That's right. And so when people come to see us, I'm the first person they're going to see.
Okay.
And so I'm going to take their history. I want to get a picture of, talk to me about your addiction. How did that start? How did it progress? What did that look like? Okay, so I want to get that picture first. Then I want to get a picture of what's your living situation right now. Are you with somebody? Do you have family? Do you have children? What's that like? How healthy, unhealthy is it? I want to get a picture of what was your life like growing up? What was that home environment like? Was it chaotic? Was it healthy, unhealthy? I want to get a picture of those things, because people have to develop an understanding of why. People have a strong prejudice against people who have an addiction.
That's true.
They are useless, worthless, no count, lazy, bum. That's the picture they have.
That
of
is
people
true.
like that, right?
Yes.
And all they got to do is quit. All they got to do is stop using it, right?
Yep.
And when people come at me with that, I say to them, okay, then let's try that. You try this. I want you to stop eating anything that has sugar in it, anything, and you let me know in a week how that goes.
It's the same.
It's the same thing. It's the
Because
same
the
thing.
sugar actually works on your brain just
Yes,
like opiates
it
do.
does, right.
Just like they do. Yeah,
Yes.
they
wants
actually
more.
They wants more and more and more.
Yes, it does. And so then we start developing a treatment plan for the person, okay? So that we can begin looking at what are your goals? What do you want to do with your life? Where do you want to go with your life? Everybody, when they first come, the only thing they want to do is just stop using. I just want to stop the madness, right?
Right.
But what I try to help them learn, and the other therapists we have, help them see and understand, is that in order to do that, you have to change, you have to make 1,000 tiny changes in every part of your life. I tell people often that Suboxone's not the answer to your problems. It's a tool, a great tool. But the biggest work in recovery is from the neck up.
Wow.
You've got to learn to change how you think, how you interpret situations, how you react to situations. And so that's where the therapy comes in. When we first started this, 15 years here at the clinic at Hometown, I would see the person the first visit, then they would see the doctor. I wouldn't see him again.
Oh, wow.
Yeah.
Wow.
And so then occasionally somebody would say, is it okay if I keep seeing you, talk about some of this stuff? I'd say, sure you can, that'd be fine. Well, after a year, we started looking at our stats and saw that the people that kept doing the counseling had a better success rate than those that didn't.
Sure.
So that's when we said, well, we may not be too smart, but we can figure that out, right? So we want that to be a part of it. And so that's always been a part, that they have to, every time they come, they will see a medical provider, they will have a witness drug screen, and they will see a counselor every time they come.
Wow.
And for how long they come.
Wow. Wow. Wow, that's interesting. Okay, so, well, you don't have a drug for weight loss then, do you? Because that would that would be very nice. I mean, can we substitute that for because it works on the brain like that, and that's very
And since they found that out, so they're trying to develop other
drugs that work like that.
that will work like yes,
Absolutely.
exactly.
I can see where that would really help to stop that addiction as well.
Right.
Because addiction is addiction, whether it be alcoholism or food addiction.
Right. Exactly.
And then the opioids or, drug addictions are really bad. Now, to come to you, they don't have to have a referral from a doctor.
No, they
They
don't.
can just call the hometown clinic, and
Right.
we'll give that information at the end.
Okay, good.
And then,
And we try to see them. Sometimes we can see them the same day.
so that's really cool. So you do have a certain doctor that just focuses with you as the therapist, or is that any doctor there at the clinic can see somebody for that? Because that's a medical prescription, right?
Yeah, right.
Okay.
Exactly. So
Okay.
we're open for the OBOT is open Tuesday, Wednesday, and Thursday.
Okay.
Those 3 days of the week.
Okay. OBOT clinic.
Yes.
Okay.
And so
OBOT.
Tuesday, Wednesday, and Thursday, there's a different medical provider on each of those days.
Oh, okay.
And that's all they do on those days.
Wow. Okay.
They're solely devoted to that on that day.
Wow.
The next day, a different provider, in that way. And then the rest of the days of the week, they do their other medical practice. We've found that just works better.
So the whole time they're on the Suboxone, they need to see a therapist each time, and they go once a week. And then what do they do? Like change to once a month or something like that?
They come every week for 4 weeks, and as long as everything is looking good and they're looking stable and the drug screens are looking good, then they start coming every 2 weeks. And they would come every 2 weeks for another 6 months. And then they start coming once a month.
Wow. And you have, 300 people in your facility?
We have 300 people in the program,
Wow.
300 patients in the program.
That's really great. I guess
People
they come from
as,
all over.
They do. They come from as far away as 2 hours away to our clinic.
How do they find out about you? Because I've been in the medical field for years, and I didn't know that you existed.
We still have people show up and they'll say, I just heard about Suboxone the other day. I'm like, it's so hard to get that word out. I don't know. We're trying to do commercials and all that kind of stuff, but sometimes they hear commercials, sometimes it's word of mouth, well, I've got a friend and they started coming here and I noticed that they've really changed, and so I want to try that. And so
you had said that one of your people that's in the program actually is going to graduate from nurse practitioner school, is what I understand?
Yes.
So, wow.
They've been in the program like 7 or 8 years, and so they've made that journey from getting their nursing degree, then getting their RN degree, and then the BSN, and then and so we have people that have completely reclaimed their lives and rebuilt, or built a new life. Because some of them didn't have one to rebuild from. You know what I'm saying?
And the good thing, what you do with this, when you're talking about ministry, you change generation after generation.
Yes, I truly believe that.
Oh, I believe that
truly
too.
That,
Yeah.
Because their kids are going to have a different life.
Totally.
Completely. And some of these people, when they come, their kids have been taken away from them because of their drug use. And so in the course of time being with us, we facilitate, we'll write letters, whatever we need to help them. They get those kids back again, get custody of those kids back.
Wow.
And there's nothing, I can't imagine what that feeling is like for those mothers and those parents to get those kids back. And, and so we used to have a rule that if you fail 3 drug screens, then you're discharged and you can't come back.
Wow, okay.
But we found out that the better thing to do is to pull people closer. And so if you're coming once a month and suddenly you start failing drug screens, then okay, you got to start coming once a week.
Once a week.
Something's happened. I don't know what's happened, but something's changed. So let's get you back on track again. We want to work with you to try to get you back to where you once were. Because nobody's progress is like this, right?
Never.
Everybody's going to stumble. We all stumble, and so we don't make a big deal of that. You just okay. So you stumbled, you fell. Okay, let's get back up. Let's keep going.
Well, I'm glad that you've seen that's a real important part of it, because people don't do well when sometimes you just do stumble.
Yes.
When I'm on a diet, I stumble. And like you said, if you tell somebody to quit out sugar, you can't do that. You tell me how it feels in a week. And that's a good way to explain to people that you don't really need to stereotype these people. And we're all guilty of that.
Yes, I think so.
I think everybody's guilty of it. You have to find, we were talking about the fentanyl thing earlier, and I never understand, and I'm like that. I'm like, why do people put fentanyl in medication? Why do these drug dealers put fentanyl in medication? Because it might just kill their clients off. It doesn't make any sense.
Right.
And when somebody explained to me that, they put the fentanyl in there to make them addicted more to the drug.
Right.
And then also you explained to me that it gives them a bigger high, so they think this person has the better drugs,
Right.
so they'll buy from them. And it didn't make any sense to me why the whole Narcan thing, and I'll just say that I didn't understand it.
Right.
And I'm a nurse. I've been in the medical field for 36 years. I should understand these things. But I didn't understand them until it was explained to me. And then people have Narcan on hand because you never know when you're going to get laced with fentanyl.
Yes.
Because your drug dealer, like you talked about before, they don't know what they're putting in their pills.
No.
They got pill presses. They make pills, and then they sell them, and it's like a meth person cooking meth. They just put whatever they can find in it. Interesting, you're talking about the drug screen. So go ahead and tell us about the drug screen, if you would, and people coming in with that.
Okay, so sometimes when people come in for their second visit, then I'll share with them what their drug screen looked like from their first visit.
And that's a urine drug screen.
Yeah, thank
Okay.
you. Yeah, thank you.
Okay, that's okay.
Because I always ask them in the first visit, what's going to be in your drug screen today?
Right.
Because that's their first chance to be honest with me.
Wow.
Or not.
Or not.
Right. And so then I'll show them their drug screen, and sometimes it'll have fentanyl in it. And their eyes will get really big, like, all those others, yeah, but I've never done fentanyl in my life. And I'm like, well, yes, you did. You just didn't know. It was in some, it was either in the Xanax, or it was in the Percocet, or it was in something else that you took in that way. And, so one of the criticisms of Suboxone clinics is people say, well, they're just swapping one drug for another. They're still an addict.
And that's what I would think if I heard it and didn't talk to you. And that's
Right.
why we're talking about this today.
So let me try to help that. For a person for me to diagnose a person with an addiction, then there have to be certain criteria. I've got a big, thick manual, of all these mental illnesses, and they have to fit these criteria.
The
Okay?
DSM. I think.
That's it. And so to have an addiction, you have to have all of these different criteria. Seeking more drug than you are prescribed, trying to find more, doing things illegally to get more, doing things that are harmful to your family, to your own health, in pursuit of the drug.
Okay.
Okay?
Yeah.
All right. Nobody who takes Suboxone does any of that.
Wow.
Nobody's out on the street trying to take more Suboxone.
Oh, I see.
Nobody's out there, trying to take 7 or 8 Suboxone. Nobody is stealing from their neighbor so they can sell a bicycle so they can go buy more Suboxone. It isn't that. So it doesn't even fit. A person is physically dependent upon it, okay? So their body does become physically dependent on it.
No, that's good
so
to
that
know.
if they stop, they will have some withdrawals from it. It's the one thing I hate the most about it. But a person doesn't become addicted. There's a difference in having an addiction and being physically dependent. It's a big difference there. And so the other thing I tell people, try to help them think about this a different way. Addiction is a chronic disease. It's not an acute disease like your broken arm, you put a cast on it and you're done. Addiction just never goes away completely. It goes into remission, that's what we say.
You always have to treat it.
You just have to be aware. You have to be aware. And so a person, I compare it to a person who has diabetes, okay? A chronic condition. And so they go to the doctor And as long as they take the medication like they're supposed to and do the things the doctor says, then they're going to have a healthy life. Same thing is true with Suboxone. As long as they take their Suboxone, do the things, change the way they live their life, then they're going to be sober and do the right thing. And no doctor is going to tell a diabetic, well, you've been on this long enough. We're going to take it away from you, right? So our philosophy is, at the clinic, it's up to the person how long they take the medicine. If they want to get off the medicine after whatever period of time, we'll be like, okay, well, let us help you do that.
That was another question I had. So whenever somebody decides they don't want to take it anymore, then you guys would taper it down?
It's a very slow taper.
Very slow taper.
Very slow taper, because you want to have a soft landing, not a crash.
Sure, absolutely.
Because if you crash, you're going to go out and do something wrong.
Right. Now, once they your success rate on people getting off of it, is that very high, or do people usually just stay on it?
The vast majority stay on it.
Okay.
And I'll ask them sometimes, we have people who have been taking it for 10 years. And so I'll say to people, do you ever think about getting off of it? And they'll just like this right here. They'll say, look, my life has never been this good for this long. Why in the world would I want to do anything to risk changing any of that?
Well, that makes sense. Like somebody's on a depression medicine or a schizophrenic medicine.
Right. Yes.
Then all of a sudden they think, oh, I'm better now.
Right.
And there shouldn't be any stigma to that, but there really is. People do look at people and say, why can't you get off that?
Right.
But like you said about the diabetes, I look at it like antidepressants. People have a stigma about that. Well, she takes antidepressants. She must be, she must have these phases or whatever. And so it's like a heart medication. You don't stop heart medicine.
You just don't.
And you just don't.
Right.
And
if people get off with Suboxone, they taper off, and we part on good terms, we wish them well, and they get back out there, and suddenly they take something, and they're like, oh my gosh,
I messed up.
I'm afraid what's going to happen next. They can call and come right back.
That's fantastic.
We tell them that we're going to be a safety net.
Yeah.
If it doesn't go well, just call and
Wow.
we'll put you right back in.
Well, that's like the love of God, isn't it?
It is.
Just
Isn't that
bring
what he
them in
says?
closer.
That's what he says,
That's
right?
what he says. Also, I want to ask you, are you the only therapist that there is, or
No,
is there? You have
we have
two
two
therapists.
other. We have two
okay.
other. So there's three of
Oh,
us.
there's three of you.
Yes.
So do y'all do like one day a week, or how do y'all do that?
I'm there 3 days a week.
Okay.
I'm the clinical director.
You're the clinical director.
Yeah.
Okay, I thought there was something that you did that was a directing part. So
Yeah.
you're a clinical director of the whole clinic.
Of the OBOT.
Of the OBOT. Yeah, of the OBOT. Yeah,
yes.
that's what I'm talking about. Okay. Okay. And let's see, I had one more question that was that was two. That was the two questions that I had. Anything else you'd like to, talking about the benzos and all that, Ativan, Valium, things like that. Do y'all have anything that will help with those as well?
Those are really tough.
Because they go along with the other as well.
They do. They really do.
Yeah.
And so, let me throw this in too, because you and I talked about it previously. A person has to have an addiction to an opiate to be a part of the program.
Yeah.
Now, they can have other addictions as well. They can have meth, benzodiazepines, or alcohol, whatever. But they also have to have an opiate addiction in order, because that's what our license says. We're to treat.
Okay,
That's
see.
why we do that.
Okay.
And so the benzos is it's very challenging for
Yes.
people to get off the benzos.
It is
really is.
really.
And so we have to be very careful of that, because if you can't just suddenly jerk them away from somebody, there's a risk of seizures.
Yep.
And so our medical providers are very aware of that. And so we work with people because we believe that the benzos contributes to the whole addiction picture.
Yeah, I can see that, because they just like milk and cookies. They just go together.
They are.
They really do.
Yes.
Okay, now let's talk about your marriage therapy. Now you do the therapy with the OBOT, but the clinic, and then you do marriage counseling too, or is that something you do, or you just do basically this right now?
All right, so what's interesting is doing counseling in the OBOT program is just like doing counseling, any other kind of counseling.
Yeah. Do you get to have family in it?
Because sometimes I'll see couples.
Yeah. Oh, good.
Sometimes family members will come in.
Good.
Because I want to see as many people as want to come be a part of it, because let's get all on board here, okay? Because we want everybody on board, rowing in the same direction, and so There's a very high percentage of people have trauma in their background. And so they got to deal with that trauma,
Yep.
you know, in some way. And so that's a lot of focus of our therapy with them. We want to help them come to a better place with their trauma. They've experienced a lot of losses in their life, you know, and so we want to help them deal with those grieving aspects of all that. And so the skills that a therapist, you don't have to go get new skills to do this work. That I told the two people we brought in to work with me, are like, you just do good work, because these people are just like the other people you've been seeing, except they have an addiction besides that.
Right. I was talking to a young girl, and she's in a therapy, and I asked her, I said, well, how do you deal with the problems that you have that's concerning to your parents? I said, how can you fix yourself? So you do have to, sometimes you have to fix the whole family unit or whatever to help people get better.
And sometimes people have to decide to separate themselves from family.
That's true.
Because their family is so diseased that the patient risks falling, you know, because, well, there's people, they'll say to me, everybody in my family uses. You know, my parents were meth cookers. I've had people tell me the first time I shot meth was when I was 13, and my dad did it for me.
Wow.
And so how do you stay attached to that when you want to get clean? And that's just, and it's hard, because that's my family. But they have to learn to separate themselves and get new people, new places, and new things so they can have a new life.
Just like an alcoholic with AA, or
Yep.
you have to, you do have to change your people.
Yes, you do.
Unfortunately, sometimes you do
do.
have to do that.
Yeah.
Okay, anything else you'd like to share about that, or
No,
anything?
I think that's a good.
Okay, well, don't forget that there are some huge things going on with the clinic there. And the clinic information is on the screen right here. So if you
Good. Call the McKenzie, the main clinic at McKenzie.
Call the main clinic at McKenzie Hometown Health Clinic. And they have so many different, they have Gleason, Camden, Brewston, Dresden, McKenzie, Bethel University Clinic, McKenzie, you've got all kinds of stuff there. So call the main one, but there's so much at the clinic that's just not the OBOT, the OBOT.
Right.
You got so much
And I just
other
seen that it does have listed the OBOT clinic itself
sure
under
does.
department numbers. You'll see
Okay,
it's
so-
a 207-8660. That's too far away for me to read that.
Well, I think you did very good. That's really awesome. And
If it's right, you don't know if it's right or not, right?
Yeah. Well, they can read it on the screen, and they can also get on their Google and find out Hometown Health Clinic and ask for the OBOT. If you know somebody that needs this, it's huge. It's just a huge thing to know that it exists, and I'm really thankful that you have decided to take on the call that God has given you to change generations. And I just keep saying that you are changing so many generations after generations. It doesn't stop here. It's like your new book. Let's see. Hang on. I want to say the Two Rivers, but that's not it. But go ahead and tell me the name of the book.
Between the Rivers.
Between the Rivers. I want to say Two Rivers because I read it. It's the Tennessee River and the Cumberland River, and your book talks about the rivers run up north.
Yes.
And then they dump into the Ohio, and then they dump into the Mississippi. And I really love the way you wrote that because I could see a picture of that.
Good.
And very interesting to let's talk about that book right there because you just came out, in April of this year?
It was June, or it's just, I think it was June it came out. It's
right
just came out
now,
pretty recent.
brand new.
Yeah.
Now, we'll talk about that in just a minute. Let's go to the Tucker series. Now, you have the Tucker series, and you can get them on Amazon. You also can get them, in your davidjohnsonbooks@gmail.com? Is that right? No.
Amazon's the place to go.
Amazon's the place to go, and you don't carry any extra, so you didn't bring me one to sign for me.
I didn't. So you told me you don't read.
I know, and you know, I know, that's really, thank you very much for reminding me that. Shouldn't remember stuff like that.
But I might have one in my truck I might find
Well,
when we get through here. How's
I
that?
need you to sign it for me because
Okay.
I feel like that you're a legacy, that walking on earth, because you have given so much of your. I kind of got a little emotional when I was talking to Kevin about just some of the things that I read about you and what you have done, all the things that you've done and that you've given your life to helping other people. And I just think it's fabulous. You've been married for what, 50?
50 years.
50 years. Your beautiful wife is here
know,
today.
yeah.
And that's good because you're a marriage counselor, and
Right.
that's good that you've been married for 50 years. Good job, ma'am.
There you go. That's right, exactly. She deserves an award.
And she deserves an award. Well, she's probably been a very much of a uplifter for you,
Absolutely.
and being your biggest fan. I'm sure that she has. So let's talk about the Tucker series. So how many books are in the Tucker series?
There's 5 books in
Okay.
the Tucker series. And that has always been my most popular series.
Okay.
It was the first series I wrote. I didn't start writing books until I was 60 years old.
Wow, that gives me hope then, because I'm
Right.
at 61. So
yeah,
there you
exactly.
go.
And so I sometimes say I'm the Grandma Moses of writers, you know, until I was
Wow.
later. And it really began as just a lark. I just thought, I like stories. I like to tell stories, like to listen to stories. My dad was a great storyteller. My great uncle, my Uncle George, was a great storyteller. And I can remember sitting around as a kid listening to them tell big tales, some true, some not true, you
Yeah.
know, growing up. And
Yeah.
so I just love telling stories. And so that's how the Tucker series started, was just a story about a woman who was raising her grandchildren, living on welfare. And the story starts there like late 1960s. And so the story follows her. She is a crotchety, no nonsense, I don't care what you think about me kind of a person. Most people don't like her because she's blunt, you know,
Yeah.
and she's coarse,
Yep.
right?
People don't like that.
They just don't. They just don't. And so what happens in that first book, though, is someone moves in beside her who is her polar opposite in every way.
Wow.
And she has no choice but to join with this person to help one of her grandchildren.
Wow.
And so she has to cross so many barriers, internal barriers, resistance, you know.
Of her
that's-
own
yes,
demons,
yes,
if you will.
Right, and prejudices against people like that.
Right.
You know.
Yeah.
And so she begins a metamorphosis, a gradual metamorphosis. You begin to see she has a big heart. You just would never see it.
Oh.
You know.
Well, raising her grandkids, she has to have one.
Right.
Yeah.
And so so the series follows them and the grandchildren as they begin to grow, and so that's what that series is about.
Wow. And so are you going to write any more books for the Tucker series?
No, I
they
don't plan.
done?
I don't plan to, because I've learned, just like with music, okay, you need to leave your audience wanting more. You don't want them to be like, when is they gonna shut up? You know, I'm tired. I'm tired. What time is it? You know, and so people want more.